Good evening, everyone. Welcome to the webinar from the Canadian Lung Association. We're just going to get started in a moment, but we're just going to allow folks to trickle in from the waiting room. We appreciate everybody joining coast to coast, various time zones, both in Canada and abroad. So we will just give a moment for folks to join on, and we will kick things off. So I think we're good. So a big welcome again, and thanks to everyone for joining us this evening. My name is Sarah Butson. I am the CEO of the Canadian Lung Association, and it is my pleasure this evening to host this celebration that is really dedicated to recognizing excellence in lung health. Too often we don't do that. We don't recognize those who dedicate their lives to making a difference. And this is perhaps more true in the respiratory field, where breathing is often taken for granted, and where folks such as all of the recipients this evening have dedicated their lives to protecting and preventing and managing how we breathe, often goes on behind the scenes. And so tonight, we thank you for those efforts. This evening, we had hoped to be joined by a co-host and our board chair, Nora Lacey. However, she has unfortunately fallen ill and is now unable to join. I know she is disappointed and sends along her admiration and appreciation for this distinguished group. Nora, as my co-MC, would have also provided the French elements of the program this evening, and so our apologies. We do have to make a slight adjustment to the schedule in that we can not offer a completely bilingual event this evening, but we have added, where applicable, the French text to slides, where I will be speaking in English, and we certainly encourage recipients who choose to speak to do so in your language of preference. So I want to begin this evening with a land acknowledgement, and we acknowledge the City of Ottawa, where the National CLA office is located, on the traditional and unceded territory of the Anishinaabe Algonquin, who have stewarded, traveled, and inhabited these lands for millennia. We acknowledge the enduring presence of all First Nations, Métis, and Inuit on this land. Tonight, we are joined, as I mentioned, from coast to coast and even internationally, and we encourage folks to reflect on the lands in which they join us from this evening. Okay, so I'm going to start with some background context as to what we are celebrating this evening. In May of 2023, to mark the coronation of the Majesty King Charles III, the Prime Minister announced the government's intention to award 30,000 coronation medals. The criteria for those was those who have made significant contributions to the country, a province, territory, region, or community, or an achievement abroad that brings benefit or honor to Canada. The Canadian Lung Association was chosen as a nominating partner based on our long-standing history making a national impact on lung health in Canada. And how fitting that this honor comes amidst our 125th year, anniversary year of making that difference in lung health. So we can't imagine a better way to celebrate our 125th year than to recognize trailblazers of respiratory research, compassionate and committed clinicians, tireless and determined advocates, and inspiring and supportive educators who made the most distinguished and sustaining contributions to their field. Before we get into the recipients, I want to start by thanking some of the individuals who have moved this effort along. The King Charles III Coronation Medal is a great honor, but also is a great responsibility. I want to thank our selection committee, which was made up of internal staff and board members of the Canadian Lung Association. It was also made up of some of our respiratory partners at Manitoba Lung and the Canadian Thoracic Society. So a thank you to our committee members. We also reached out to partners in the respiratory field. We know incredible work is happening across this nation and with individuals in the respiratory field through a number of partners. And we wanted to ensure that the nominations included all of those partners. On this slide are some of our recommending partners who had successful recipients nominated, many of whom have joined us this evening, and so we welcome you. And we know that you are also continuing to do ongoing recognition efforts to celebrate these accomplishments. So thank you. Okay, before we begin, there are just a few more housekeeping items. I want to take a moment to give you a sense of the run of play for this evening and really how the ceremony will unfold. By now, most of our recipients should have received a package in the mail with a recognition booklet, of course your medal, and a note of thanks. We encourage you to wear the medal this evening, should you feel it appropriate to do so. In terms of our format, we have 39 nominated individuals to acknowledge this evening, and we're going to do so coast to coast. And so we're going to start on the east coast of Canada and move our way west. A few important details for our medal recipients this evening. If you are a medal recipient, please ensure that your Zoom name is the correct name so that our webinar supporters can properly profile you at the time of your acknowledgement. You will at that point receive an invitation to be promoted to a panelist, so please accept that invitation once it arrives. If you do need to change your name and you haven't done that before, you have a couple of options. You can toggle over your screen and find the 3 buttons on the corner to rename yourself, or even easier, you can send us a note in the chat and we will ensure that you are renamed. We encourage that our medal recipients keep your videos on for this evening, particularly when you are being promoted, so that folks have a chance to see and acknowledge you. As we read out each individual, we will share a short bio, and I think you'll find, as I have in reviewing this list, it is a humbling and impressive list of individuals that we are celebrating this evening. As we read out your name and that bio, we will then offer an opportunity for you to provide some brief remarks should you choose to. At that time, you can unmute. We do ask, of course, that you keep your remarks brief, as we do have a number of individuals to recognize this evening. For our audience, family, and friends who are tuning in to celebrate those of your friends and family who have been acknowledged, we will be keeping audience members muted this evening. However, if you do want to provide additional celebrations, we encourage you to use your reaction buttons on the bottom to cheer or clap virtually. Finally, and we're seeing some hearts already. Finally, we had considered doing a group photo at the end of our webinar this evening. However, given the platform and the lovely number of individuals we have joining, we are going to forego the photo, but we have provided some options at the end of the session to encourage folks to stay on board, stay connected with us, and we encourage you to share a photo with us of you wearing your medal that we can then post to social and the website. So without further ado, it is time to begin our celebration. So we are going to begin, as I noted, on the East Coast, and we are going to start with the province of Nova Scotia. Okay, and so our first recipient is Dr. Graham Rocker. Dr. Graham Rocker developed the Inspired program, which improves care and outcomes for patients with chronic obstructive pulmonary disease, COPD, and their families by providing in-home education and support. Congratulations, Dr. Rocker, and I invite you to say a few brief remarks.
Okay, can you hear me?
We can.
Wow, miracle. Very, Very briefly, thank you so much, Canadian Lung Association. I regard this as an award not just for me, but for my team. We were, in the early days, just three of us. Joanne Young, exceptional respiratory therapist, Kathy Simpson, spiritual care guru and advanced care planner, beyond compare. We did the early research that informed the Inspired program. We understood the experiences patients had of living with advanced COPD and just how awful that was. The revolving door in the emergency room, the multiple admissions, and we felt compelled to do something about that. And so we put in place this program. I think Jean Bourbeau is on this award night as well. So Jean, thank you. We adapted your program for use, your educational program for use in the home. And we provided that to patients via a series of modules. And the whole point about Inspired was individualized care. It was not formulaic. We understood what patients needed. We provided what they wanted us to provide. And lo and behold, it worked. And so we found early on, emergency room visits fell, admissions no longer happened, and patients were really quite delighted with the care that was being provided. And subsequently, Inspired expanded, went across Canada through the Canadian Foundation of Healthcare Improvement, and was trial tested in each of our provinces. And I would not have done this without the help early on of some initial funding support from GlaxoSmithKline, always at arm's length. Sean White, thank you. And Lung Association, NSPEI, Robert McDonald, always very supportive. So that's all I plan to say. It's been a wonderful journey. I've been retired 5 years. Inspired continues without me quite successfully, and hopefully goes on and makes great strides for the future. Thank you.
Thank you, Dr. Rocker. A lasting impact indeed. Our next recipient is Dr. Sanja Stanojevic. Dr. Stanojevic has helped to establish and disseminate standards on interpreting lung function, improving population-level data, and individual testing, diagnosis, and the management of lung disease. Dr. Stanojevic, welcome and congratulations. I invite you to say a few brief words.
Wonderful. Thank you so much for this really tremendous honor. I look at the other recipients and people that I admire, people that are my mentors, and I can't believe that I'm being recognized here. And to echo what Dr. Rocker said, it's really a team effort, and it's been a privilege to work with individuals all around the world to make these achievements. And I really appreciate this honor. Thank you so much.
And it's our privilege to get to celebrate. So congratulations. Thank you. Okay, that moves us onwards to New Brunswick now. And I would now like to recognize Miss Barbara Walls. Ms. Walls had made significant contributions to the lives of New Brunswickers living with lung disease during her tenure at NB Lung. Some of her work included lung transplant support groups, asthma camps, and a needs-based CPAP program. Congratulations, Ms. Walls, and invite you to say a few words.
Thank you, Sarah. It's actually, it's quite exciting, and I'm very honored to have been a recipient, and also, of course, to see a number of names that I have worked with who also were part of my advocacy and programs. So I do have just a couple of seconds. I'm going to try and keep it in mind like it's like the Oscars, right? So the hook doesn't come out. So I would like to thank the healthcare professionals in our province and at the Toronto Lung Transplant Program, without whom I couldn't have been successful with my various programs. Their collaboration ensured the success of the lung transplant program, our secondhand CPAP program, and so on. Many initiatives and advocacy. I'd also like to thank my former CEO, Barbara McKinnon, whose visionary leadership and support enabled me to carry on and develop those various programs and initiatives. Thank you.
Wonderful. Thank you, Ms. Walls, and congratulations.
Thank you.
Okay, I will now move the program into Quebec, where our first medal recipient is Dr. Jean Bourbeau. Dr. Bourbeau has transformed the management of chronic obstructive pulmonary disease in Canada. Dr. Bourbeau is the lead author on Canadian COPD guidelines and is a strong advocate for patient self-management, including as the creator of the Living Well with COPD program. Congratulations, Dr. Bourbeau, and I pass the floor to you to say a few words.
Merci beaucoup. C'est vraiment un honneur de recevoir cette reconnaissance, et merci à l'Association canadienne, d'Association pulmonaire du Canada. This is a real honor, and thanks to the CLA. On ne peut pas recevoir un honneur semblable sans avoir eu des gens qui ont travaillé avec nous. Donc, c'est toute une équipe. Je voudrais remercier depuis au moins 20 ans, sinon plus, les gens qui ont contribué à mieux vivre et aussi la société à but non lucratif Respi Plus. Donc, les gens qui ont travaillé avec moi ont été remarquables et m'ont permis, d'obtenir cet honneur. Mais au bout de tout, ce qui est le plus important, c'est des patients qui nous ont inspirés et qui nous permettent, d'avoir réalisé et de faire ce qu'on a pu faire, Et ces patients-là nous ont permis, d'obtenir cet honneur-là. On espère que les patients vont continuer à bénéficier, par les générations qui vont suivre, par notre exemple et qui vont continuer, à travailler en recherche et aussi appliquer cette recherche, au quotidien. Donc, I'd like to thank everyone again, all the people that have worked with me, and a special thank to the patient and the patient that had inspired this research and this work. Thank you.
Wonderful, and congratulations again, Dr. Bourbeau. Our next recipient from Quebec is Dr. Francine Ducharme. Dr. Ducharme has improved the management and treatment of asthma in young children through her commitment to finding new and better ways to translate research knowledge into action. Dr. Ducharme has developed several research instruments now used in clinical practice. Congratulations, Dr. Ducharme, and I pass to you to say a few words.
Thank you very much. It's a real honor to receive this medal tonight, along with all of my colleagues. I want to thank the selection committee for proposing my name and that of my esteemed colleagues whose commitment in improving science and respiratory health are also honored today. Canada is recognized worldwide for its leadership in respiratory research, and when I think why, it's collaboration and mutual respect. We are really a tightly knit group of researchers with a unique philosophy of cooperation, with a strong track record in mentoring our youth. And this was made possible thanks to the Canadian Lung Association, of course, and its multiple provincial partners that contribute to the advocacy of our patients, to the Canadian Thoracic Society that engage in dissemination of science and implementation. And I have to add to the Canadian Respiratory Research Network that has been spearheaded by Sean Aaron, who's being honored today. But he had the vision to bring us Canadian respiratory researchers together annually to develop common research endeavors, to share new methods, to collaborate, and to offer a stage to showcase our brilliant next generation of researchers. And although the operating grant system forces our projects to compete for funding, we're not really competing against each other, as we have more opportunity to receive and provide feedback to improve each other's science and to work together in lung initiatives and implementation science. I want to thank my husband, my parents, my children who supported me throughout my career, my research team and students who helped me along the way, and my patients that inspired me. When my family describes my relationship to science, I think they all agree in one word: I'm passionate. I'm passionate in improving the care and developing multiple tools to adequately assess children, to improve management and health outcomes of children with asthma. And I've attended scientific presentations or work in committee alongside with most, if not all of my colleagues who are honored tonight. And I can attest that they evidently share the same passion for lung health, the same commitment to the highest research standards, the same resilience to overcome multiple obstacles to ensure the success of our project. And they share the thrill of new discovery, and most importantly, they benefit from the unequal satisfaction of advancing care for Canadians and abroad. Merci beaucoup.
Thank you, Dr. Ducharme. Congratulations, Dr. Ducharme, and congratulations once again. We now will move on to Dr. Larry Lanz, our next recipient. Dr. Larry Lanz is internationally recognized for his work related to inflammation and exercise in cystic fibrosis and bolstering immune defense in both children and adults living with chronic lung disease. I am also proud to say that we have the added pleasure of having Dr. Lanz serve as a dedicated volunteer and director on our board at the Canadian Lung Association. So congratulations, Dr. Lanz, and I will pass to you for any remarks.
Well, thank you. And I'm truly honored for this nomination from the Canadian Lung Association. And I'd like to underscore the role the Canadian Lung Association has both in advocacy, but also in helping to develop the next generation of researchers to their funding programs. It's been a great pleasure to watch new young researchers go from being students to establish themselves as new funded investigators. And it's lovely to see the breadth of ability that we have in Canada. We definitely punch above our weight in terms of research ability and recognition around the world. And I've been so proud to be able to contribute to that through my work through the Canadian Lung Association. Of course, I certainly have had great pleasure in doing research. I'm always inspired by what I see clinically and involved with both clinical research and bench research, that my clinical activities influence what I do on the bench, and the bench comes back and influences what I do clinically. And it's been a wonderful journey, and plan to continue. And just to underscore, tonight I'm talking to you from Rouyn-Noranda, where I'm doing pediatric lung clinic and pediatric cystic fibrosis clinic. So it's important that we reach out and provide services to all people living in Canada. Thank you once again.
And we hope you do continue, Dr. Lanz, and congratulations once again. We now continue our move west across the nation into Ontario. And I will begin with our first recipient from Ontario, Dr. Sean Aaron. Dr. Sean Aaron has helped improve the diagnosis, treatment, and management of chronic obstructive pulmonary disease, asthma, and cystic fibrosis in Canada, and has already been noted is the creator of the Canadian Respiratory Research Network. Congratulations, Dr. Aaron, and I pass the floor to you.
Thank you very much, Sarah. Pour moi, c'est vraiment un honneur de suivre Dr. Bourgault, Dr. Lanz et Dr. Ducharme. Mes collègues sont estimés et pour moi, c'est la chose plus intéressante de faire de la recherche et de travailler avec mes collègues. I was saying that for me, it's a real pleasure and honor to win this award, but also to follow such esteemed researchers from Quebec. The whole reason we started the Canadian Respiratory Research Network was to further research within the country. And for me, the overwhelming positive part of all this was getting to work with the nicest, most intelligent people, I think, in the world. So I'm just very grateful to everybody, and I'm grateful to the Canadian Lung Association for making this happen. Thank you.
Thank you, Dr. Aaron, and congratulations once again. Our next recipient out of Ontario is Dr. Anju Anand. Dr. Anand has enhanced medical education and patient health literacy with innovative technology. Dr. Anand is an advocate for marginalized and racialized communities, including having founded the South Asian COVID Task Force. Dr. Anand was unfortunately unable to join us this evening, but again, we congratulate you on this esteemed award. Okay, we will move to our next recipient, Mr. Vibhas Babbitt. Mr. Babbitt is a longtime volunteer committed to improving asthma care with Asthma Canada. He has served as a community ambassador, advocate, and as chair of the board of directors for Asthma Canada. Congratulations, Mr. Babbitt. I will pass to you for a few remarks.
Thank you so much, Sarah. I wasn't quite sure how to wear this with the protocols, but I'm so proud to have this. Thank you to the Governor General's Office, the Canadian Lung Association. Congratulations to the CLA for 125th anniversary. And Asthma Canada actually celebrated its 50th anniversary last year as the only national organization or charity in Canada focused on asthma, fundraising, research, and advocacy. Many of you know us and help us with the work we do, including the great Dr. Susan Wasserman, who is the head of our medical and scientific community. I'm just so grateful and humbled to be in really illustrious company this evening. And this kind of recognition is so inspiring and it's so encouraging. Thank you so much.
And thank you for all the work that you do, and congratulations once again. Our next recipient this evening is Ms. Marianne Bradley. Ms. Bradley is a lung cancer patient advocate, pushing for legislative changes that improve the quality of care and support that is available to those who need it, including creating resources and tools to support other patients in their journey. Congratulations, Ms. Bradley, and I will pass to you should you choose to say a few remarks.
Well, thank you very much, Sarah, for that wonderful introduction. I would like to thank all the advocacy group that voted for me to be nominated, and also for the Lung Association for supporting my nomination. So I have been doing this volunteering for lung cancer advocacy for 10 years now. And lobbying the government actually is my most favorite thing to do, because for some reason they do like to listen to me. So I feel like I do make a difference. But advocacy, as you know, doesn't stop there. So I am so honored to be receiving this medal. It means so much to me. And I am thankful to all of you and all the award winners this evening that are here to celebrate with me and my medal winning. So thank you very much.
Thank you, Ms. Bradley, and congratulations. Our next recipient is Dr. Dina Brooks. Dr. Dina Brooks is recognized internationally as a leader in cardiorespiratory rehabilitation, focusing her research on rehabilitation and physical activity in patients with chronic obstructive pulmonary disease. We thank Dr. Brooks for all of her hard efforts, and I would invite Dr. Brooks to speak, should you choose to do so.
Thank you, Sarah. Yes, thank you for my nominators and for the Lung Association for the support in this King Charles III Coronation Medal. It's been over 30 years since I started doing work in research and education, and it has all been dedicated to individuals with lung disease, an area that remains significantly understudied. And through this journey, the support of the Lung Association has been instrumental, and I'm deeply grateful. I also want to acknowledge my fellow recipients. It's really an honor to stand among such remarkable individuals. And lastly, a heartfelt thank you to my incredible team and my family for their unwavering support. This recognition is as much theirs as it is mine. Thank you.
Thank you, Dr. Brooks. Okay, I would like to move on to our next recipient this evening, Mr. Neil Collishaw. The late Mr. Neil Collishaw worked for decades to protect Canadians and the world from the harmful effects of tobacco. He played a pivotal role developing and implementing national legislation and in the development of the World Health Organization's Framework Convention on Tobacco Control. He left a true legacy. Mr. Collishaw passed away October 2024, but we are joined this evening by his family. And I believe I am inviting Barb Collishaw, his wife, to say a few words, if you like, in his honor. Go ahead, Barb.
Thank you. We are honored. When Neil died, we found he was greatly appreciated by his colleagues from around the world. And that really touched our heart. I have with me my daughter, Rachel, and her daughter, April, and our friend Cynthia Callard, who worked with Neil for a number of years on the Physicians for a Smoke-Free Canada. Neil was an advocate. He was a scientist. He was a terrific family man. And he gave as much passion to his family and having a good time with us and teaching us all things as he did for saving everybody from smoking. Right?
Indeed. Thank you.
Okay.
Gabby. Yeah, that was great.
So, we have the medal.
Wonderful. And we are indebted to Neil and to you as his family for his lifetime dedicated to those efforts. So we thank you and a congratulations to you.
Thank you.
Thank you.
Okay, and with that, we will move to our next recipient of the evening, who's Dr. Andrea Gershon. Dr. Andrea Gershon is embracing innovative approaches like the use of big data and remote monitoring and wearables in her research to improve quality of care and health outcomes for people living with lung disease. Dr. Andrea Gershon, we congratulate you, and I will pass to you if you'd like to say a few remarks.
Sure. Thank you. Thank you so much. This is such an honor. This is so special to get honored for something that you really love to do. I'd like to thank the Canadian Lung Association. I'd like to thank other organizations that have really helped me with my career and my research, Canadian Thoracic Society, Canadian Respiratory Research Network that you mentioned. I'd like to thank my colleagues, many of you who are here, who I really enjoy working with, who make it fun. I'd like to thank my mentors who have helped me along the way. I'd like to thank my students who give me energy. I'd like to thank my friends and my family who have put up with me all this time. And I really like to thank the patients who inspire me in my work. Thank you.
Thank you, Dr. Gershon, and congratulations. Our next recipient this evening is Mr. Ralph Gouda. Mr. Ralph Gouda is the founder of Lung Cancer Canada, which was the first organization in the country dedicated solely to lung cancer, providing patients and caregivers access to vital information, support, and resources, and it still continues to do so to this day. So a big congratulations to Mr. Gouda, and I believe we have his son, Naguib Gouda, who will be saying a few words in his honor.
Thank you, and thank you for pronouncing my name so well. Every word I'm about to say, my dad helped me write, and there's not a word that he's not approved. So I'm speaking on his behalf. I'm deeply humbled, honored, and grateful to receive this prestigious award. Je suis profondément honoré, touché et reconnaissant de recevoir ce prix prestigieux. Lung Cancer Canada was founded in memory of my late wife, Nadia. This was only possible due to the support I received from two very important people, Dr. Yi Ung and Magdalene Winterhoff, along with our founding board. A very special thanks for the incredible and ongoing work done by the organization's staff under the leadership of Shem Singh and the current board. Un grand merci sincère à nos donateurs fondateurs et actuels d'un océan à l'autre, et surtout à mes enfants, Nagui et Nadine, et leurs conjoints, Jennifer et John. Finalement, et sans doute, à mes 3 petits-enfants, Joseph et Nicolas, qui ont égayé la vie de leur grand-mère pendant le temps qu'ils étaient avec elle, et à ma chérie Beth, dont son caractère et ses réalisations auraient rendu Teta fière. Support, advocacy, and education for all those living with lung cancer and their caregivers is only possible due to everybody who is still working for Lung Cancer Canada. Merci à tous. Thank you to all.
Very good news. Thank you.
And we deeply thank you for that work, and congratulations once again.
Very good.
Thank you, Mr. Gouda. We will now move to our next recipient, Dr. Samir Gupta. Dr. Gupta is a leader in science communication, bringing easy to understand, evidence-based lung health information to the general public using social and mass media. He also led the development of innovative software to improve asthma. Dr. Gupta, for your work, and I will pass to you for some remarks.
Thank you so much, Sarah. Je vais commencer par remercier l'Association pulmonaire du Canada. And I'll echo what my colleagues have said, that it's just such an illustrious group of people who have received this honor. Just reading the names was astonishing, and it really is the honor of a lifetime to be mentioned with these colleagues. And I say colleagues because really many of us are colleagues, have worked together, we're friends, folks who are active in the clinical space, research space, and advocacy space. And as Dr. Ducharme said, it's amazing that you look at this list. So many of these people have worked together, and that just tells you how collaborative the environment is in this country. And I think one of the reasons we punch above our weight, as Dr. Aaron likes to say, again, another colleague and mentor. I've had the privilege and the honor of contributing to lung health as a clinician, also as a scientist, and shout out to the Canadian Lung Association, because many moons ago, I received funding from the CLA for my master's in clinical epidemiology, and that was the foundation for my research career. But also, as you said, Sarah, as a science communicator. And it's been such a privilege to be able to try to communicate science to the public, try to educate and improve science literacy and health literacy in the public. And I hope in that process, raising the profile of lung disease and knowledge and awareness of lung disease among members of the public. So I hope to continue to do that, and promise to always wear this on all my future social media posts. But thank you for this honor, and congratulations to all of my colleagues.
And we thank you, Dr. Gupta, and congratulations once again. We will now move on to our next recipient, Dr. Alan Kaplan. Dr. Kaplan promotes and educates on best practice in respiratory care, including proper use of spirometry in primary care, national chronic obstructive pulmonary disease guidelines, and serves as a resource for other family physicians regarding respiratory health. Congratulations, Dr. Kaplan, and I'll pass to you if you'd like to say a few words.
Thanks, Sarah. Thanks to the Lung Association for this honor. It's wonderful to be recognized, and it's quite my colleagues here that are here are just such an impressive group, and some are such good friends that it's just such a pleasure to be here. You know, I'm a family doc, so I started off wanting to be a small town family doctor and working in the office, in the emergency room. Back when I started, it was nonstop people with asthma doing poorly. And I then had the pleasure of meeting Dr. Jerry Alexander, who was the first chair of the Family Physician Areas Group of Canada. He's now deceased, so we miss him. And he was ahead of his time when it came to asthma. His patients were managed with asthma. They're completely controlled. They almost never used their short-acting beta agonist. It was quite impressive. And he taught me how we can actually punch above our weights as primary care clinicians. And really our goal then became, We wanted to have family doctors and primary care clinicians be able to manage asthmatics and keep our patients well and keep everyone well. And that then turned into other conditions. So I just want to thank you for the honor. Thank you for allowing me to be here. And I want to thank all the people who've been along the journey with me, and particularly, of course, my wife and kids. Thank you.
And a thank you again, and congratulations. Okay, we will now move to Dr. Diane Lauheed, the Director of Local Asthma and Cystic Fibrosis Programs. She has helped to improve and standardize hospital care for adults with asthma, both in practice and through her research. So congratulations to you, and I will pass to the floor if you want to say a few remarks.
Thank you very much, Sarah. It is truly an honor to receive this award, particularly amongst so many of my and our esteemed colleagues across the country. I'll also say it's a particular honor to have been nominated by what I consider to be an amazing charity, that is the Canadian Lung Association. It is a privilege to work with my clinical care teams and students. But it's also been an incredible privilege, as I'm sure many on our webinar this evening would share, to have had the opportunity to be part of the Lung Association. I was fortunate enough to have had the chance to serve on its board of directors and with our professional societies with which the Lung Association is and has been affiliated for decades, to work together to improve lung health, advocacy, research, translating evidence into practice through our guidelines initiatives. Has really been fun and an honor to see their benefit. The networking opportunities that I think we've all been commenting on tonight of our committees, conferences, the research networks, working group and task forces, not only accomplished our objectives, but fostered a community of like-minded professionals where the whole was and is greater than the sum of its parts. So I am truly honored and want to thank you, the committee, my colleagues, friends, and family for the support. Thank you so much.
The pleasure is ours. Very well deserved. Our next recipient this evening is Ms. Lynn McDonald. Ms. McDonald was serving as a member of Parliament when she introduced a private member's bill, Bill C-204, in 1986. This bill would become what we knew as the Non-Smokers Health Act, the first legislation in the world to establish smoke-free workplaces and public spaces. And I believe that Ms. McDonald is unable to join with us this evening, but again, a congratulations to you and a thank you for all of your efforts to protect the air that we breathe. Moving to our next recipient, we have Dr. Grace Parega. Dr. Parega is committed to a better understanding of lung structure and function. She has developed some of the first MRI-based measurements of lung disease, with the goal of using imaging to help guide personalized therapy and ultimately improve long-term outcomes. Congratulations, Dr. Parega, and I will pass the floor to you for some remarks.
Thanks so much, Sarah, and thanks to everyone on this call. I'm really humbled and honored to be here with all of you and to be recognized in this way. I want to reflect on the fact that research is utterly fragile and success is never guaranteed. There's a lot of delayed results. There's a lot of uncertainty. Complex results are very difficult to contextualize and communicate, and that's why we need the help of the Canadian Lung Association, the Canadian Respiratory Research Network, our colleagues, the Canadian Thoracic Society, and others. You know, I reflect on the roughly 300 different trainees who've come through my lab, and I need to thank them for all their support. And yesterday we had patient 1,000 who came into the lab to support research. We've had 1,000 patients now attend 5,000 visits, and we do this research for patients and with patients. And we really, all of us together, hope to make a difference. So thank you very much.
Thank you, Dr. Parega, and congratulations once again on a well-deserved award. I will now move to Dr. Elizabeth Toulis, Dr. Toulis founded the Toronto Adult Cystic Fibrosis Center, the largest in North America. Her commitment to multidisciplinary care and early use of telemedicine has helped Canada achieve the highest median survival in the world for adults with cystic fibrosis. Dr. Toulis, congratulations. I will pass to you to say a few words.
Thank you, Sarah. I'd really like to thank the Canadian Lung Association for this honor. It's amazing listening to all of the people who have been honored tonight and the words that they've had to say. And I really hear a theme of this evening being teamwork. And I personally feel that that the gratitude to the partners that I've had in my journey in looking after people with CF. And that's not only the amazing and dedicated CF team at our center, but in fact, my CF physician colleagues from across the country, and some of those who are honored tonight. And so it really is personally very meaningful for me to have this honor. And I'm very grateful for the fact that Canada, has had all this success in CF care and in research. And I think it is because of how not only the patient organizations and the clinicians and the researchers all work together to improve the health and life expectancy of those living with CF. So thank you very much. This is really a very moving evening for me. Thank you.
Thank you, Dr. Toulis. Congratulations once again. We move now to Dr. Susan Wasserman. Dr. Susan Wasserman researches the mechanisms and treatment of asthma and allergies. She raises awareness of allergies and allergic reactions and has developed corresponding practice guidelines. Dr. Susan Wasserman, thank you for joining. Congratulations, and I will pass to you if you'd like to say some remarks.
Thanks very much, Sarah. Anyway, I'm extremely honored to be a recipient of the King Charles Award, and there are so many thank yous to say at a time like this. Jeffrey Beach, our amazing president of Asthma Canada, for having nominated me, the Canadian Lung Association, my patients and colleagues and trainees at McMaster University, the Allergen National Centers of Excellence under the leadership of Diana Royce and Judah Denberg, all of whom have nurtured me all these years, and of course my wonderful family who has supported me throughout. I also want to congratulate all my fellow co-winners, many of whom I've had the pleasure of collaborating with, and a special mention of Vipis Bafat, the chair of the Asthma Canada Board of Directors. This recognition is extremely special to me, and it reinforces my commitment to support Canadians living with asthma and allergies. So again, many thanks to the Canadian Lung Association for this honor.
And we thank you, Dr. Wasserman, for your unwavering commitment. Thank you. Okay, and our last recipient out of Ontario is Dr. Amy Wong. Dr. Wong is a pioneer in using human stem cells to model lung development and disease. She was the first to develop a method to generate airway epithelia, testing my my phonetics here, that models cystic fibrosis lung disease in vitro. Thank you to Dr. Wong and congratulations, and I will pass to you for remarks.
Thank you, Sarah. I have to echo all the winners here in that I'm truly humbled and grateful for this award. So I have to thank the Canadian Lung Association for the nomination and the Governor General's Office for the award. I also have to thank the peers who put forth my name for the nomination. And I also echo many of the winners here in that this award could not have been possible without the support of many. My graduate students, undergrad students, postdocs in the lab, my former mentors who have supported my work from the very get-go, to the Canadian Stem Cell Network, who has supported our work from the very, very beginning, as well as the Canadian Cystic Fibrosis Foundation. And so with that, I am truly, truly grateful. So thank you very, very much for this medal.
We thank you, Dr. Wong. So congratulations to the recipients from Ontario, and we will now move into Manitoba. Now, in Manitoba, this evening, our friends at Manitoba Lung have organized a group of the recipients to gather together in person. So I understand some will be gathering in person and some will be gathering virtually. Our first recipient is Dr. Alan Becker. Dr. Becker was the lead author of the first ever Canadian guidelines on pediatric asthma and has contributed to asthma guidelines worldwide, leading major birth cohort studies that improve our understanding of the management and prevention of childhood asthma. So congratulations to Dr. Becker. Now I understand Dr. Becker is unable to join this evening, but he did send along some remarks, so I will read those out now. Dr. Becker says, many thanks to the CLA and the nominating committee for the honor of receiving the King Charles III Coronation Medal. The Canadian Lung Association has been instrumental in support for my work in developing asthma guidelines. Initially as a member of the very early Canadian guidelines, then as a leader of the first Canadian pediatric guidelines, and subsequently with other Canadian Thoracic Society members on the global strategy for asthma management and prevention. Equally important was CLA's support for the development of national certification for asthma educators, which I led and which was the first national certification. So a big congratulations to Dr. Becker on this award. We will now move to our next recipient, who I believe is joining us virtually, Dr. Andrew Haleko. Dr. Haleko is an internationally recognized scientist in asthma and COPD, studying the effects of inhaled pollutants and infection on lung development and long-term health. He's helped establish Canada's first multidisciplinary research center dedicated to this study. So congratulations to you, Dr. Haleko, and I pass the floor to you for some remarks.
Thanks very much, Sarah. It's really an honor. First, congratulations to the CLA. Happy birthday. And to the other recipients whom I'm guessing 75% of them I have worked with or done something with. So it's really thrilling to be in the room with all of them. It's truly an honor, a distinction to be here. I'm gladly accept this on behalf of the team of people who worked with me for many, many years. And, you know, when I first learned of this, one of the first things I thought was how wonderful it was that the Canadian Lung Association was given the opportunity to nominate recipients because it acknowledges the importance of lung health. You've made your mark, which you've always wanted, and we've tried to help you do. And I think it acknowledges the threats that still exist: climate change, air quality, cigarette and cannabis smoking, e-cigarettes. It's all still there. It's not going away. So it's a privilege to have been able to work with the Canadian Lung Association, the Manitoba Lung Association, and the Canadian Thoracic Society for well over 2 decades now. We've helped lead some critical research endeavors nationally, as well as training endeavors. You've heard about the Canadian Respiratory Research Network, and I was personally involved with CLA when they anteed up over $1 million towards that network that went towards the training. So good on you, CLA, for that. Collaboration is a word you've heard a lot, and I'll echo it today. It's been thrilling to do that. And you may notice my background. I'm in a hotel room. I happen to be at a meeting in Toronto at the King Edward, the Omni King Edward. It's a very regal background, so I deliberately have it there for you. And I mention it because the last thing I want to say is that this is another hotel room, another few nights away from home. And I think at home is my wife, Allison, and my 2 kids, Martin and Liam, who had many weekends when Dad wasn't there because he was off doing all this stuff. And I really, accept the award on their behalf as well. Last comment. Hi, Mom.
Wonderful. Thank you, Dr. Haleko, and again, a very well-deserved honor. We now turn to the room in Manitoba, where our first recipient is Ms. Debbie Homick. Ms. Homick dedicated her life as a respiratory therapist who raised awareness of and supported those living with pulmonary fibrosis, leading awareness raising and programming efforts. And so congratulations to you, Ms. Homick, and pass the floor to you if you'd like to say a few brief words.
I'd like to thank you for the nomination. I am totally humbled and honored to receive this award. My work with the pulmonary fibrosis community, I found incredibly rewarding, and it's given me great purpose in life. I continue to work and advocate for that group. I'd like to make a special thank you to the Manitoba Lung Association for all the support they've given me in all my endeavors. They're always there behind me, supporting me, and thank you very much.
You're very welcome, and congratulations to you. We now move to Mr. Neil Johnston. Mr. Neil Johnston is a respiratory therapist by trade and who worked for most of his life with the Manitoba Lung Association, including as their CEO, where during that time he founded several lung health programs and advocated for healthy public policy. Mr. Johnston, I will pass to you for remarks.
Good evening, everyone from Treaty 1 territory. I'd like to thank the CLA for the award and the Manitoba Lung Association for the nomination. I'd like to thank everyone in this room for your support. Various aspects of my career, both as a respiratory therapist, as a volunteer at the Lung Association, as a staff member of the Lung Association, just goes to show what happens if you hang around long enough. They hire you, they give you medals, there's some good snacks. But in all honesty, I'd just like to thank everyone for all the support and all the work that we've done together in various elements of helping people breathe easier. Thank you.
Thank you, Mr. Johnston, and congratulations again. I now invite our next recipient, Dr. Nilofer Mukherjee, to come up. Dr. Mukherjee investigates the immune response to inflammation and sex differences in disease progression and response to treatment, with the ultimate goal of developing immunomodulatory therapy for chronic diseases such as asthma. Congratulations, Dr. Mukherjee, and I invite you to say a few words.
Thank you so much. And I am here with all my colleagues and friends from Manitoba Lung Association. Thank you, CLA, for the nomination. I'm deeply, deeply honored. I want to congratulate all the recipients, many of whom I have worked with, their colleagues, friends, and mentors. It would be amiss if I don't thank my husband, Dustin Lippert, who puts up with me. And finally, I would like to say that I dedicate this recognition to women in science in Canada and beyond. Thank you.
Thank you. And congratulations once again, Dr. Mukherjee. Our final recipient from Manitoba is Dr. Christopher Pascoe. Dr. Pascoe investigates how genetics and environmental risk factors may prevent future chronic lung disease in order to develop strategies and treatments to reduce risk and prevent and move into disease management. Dr. Pascoe, congratulations, and I invite you to say a few words.
Thank you. First off, thanks to the Canadian Lung Association for the honor, Manitoba Lung for nominating us and hosting us tonight. Great to be amongst such great scientists and company. I feel bad for everybody who comes after in the program because there's not much left to say at this point other than thank you, thank you, thank you. So I'll thank all my mentors who've helped me get to this point, both in the Canadian Lung Association, the Canadian Respiratory Research Network, the Manitoba Lung Association, my family, who's cutting off to the side there, and the littlest one who's pretty quiet right now. Thank you for everybody who've supported me, got me to this point, and again, thank you for the honor.
Wonderful, and congratulations again to you, Dr. Pascoe. So congratulations to our recipients from Manitoba. We continue our journey west into Saskatchewan. Our first recipient from Saskatchewan is Ms. Tina Campbell. Ms. Campbell is a registered nurse and a person with lived experience of tuberculosis. She champions cultural competency training for healthcare providers who work with Indigenous populations across Canada. Congratulations to you, Ms. Campbell, and I invite you to say a few words should you choose to do so.
Good evening or afternoon, wherever you're joining from. Can you hear me okay?
We can, thank you.
Tansei, Tina Campbell Nitsigason. Thank you so much for this incredible honor. I am truly humbled to receive the King Charles III Coronation Medal. I am an Indigenous woman of Cree ancestry hailing from Treaty 5 territory. I was raised in Iqaluit Nunavut, where I began my career in public health at a TB clinic. My personal journey with TB began my first year of nursing school when I was diagnosed with TB through an occupational health screen. This diagnosis marked the start of my 15-year and counting commitment to tuberculosis care. My career as a healthcare provider in TB started while I was undergoing treatment myself. So this dual experience, both as a patient and a provider, taught me the complexities of the disease and the challenges involved in creating individualized care plans for each patient and their family. Along the way, I learned about the unfortunate legacy of TB sanatoriums and the lasting mistrust and stigma they have left in our communities. My kukum, or grandmother in Cree, and my aunt were among those who were sent to TB sanatoriums, and learning about their experiences further fueled my determination to advocate for culturally appropriate TB care. As a nurse with lived experience of TB, this recognition is not only a personal achievement, but also a tribute to all those who are advocating for improved healthcare and cultural competency for Indigenous populations. I am deeply encouraged to see TB being included in important conversations, and I am honored to continue shining the light on the ongoing challenges we face. Let this recognition also serve as a reminder that there is still so much work to be done in the fight to eliminate TB. I do not take my advocacy lightly. It is a complete honor to share the experiences of my kukum and aunt from our past. A picture of my grandmother that I carried with me everywhere. She is sitting outside of the TB sanatorium in Fort Capel. I advocate to ensure that care for our children, like my son Colton, and my nephews, and all our future generations have access to culturally safe and competent care. I would like to express my heartfelt gratitude to my family, my friends, and colleagues, past, present, and future, for their unwavering support and the invaluable experiences we have shared. It is truly a privilege to work alongside so many dedicated individuals in the ongoing fight to end TB and improve lung health in Canada. Together, we can continue to make a meaningful impact. A special thank you as well to the Canadian Lung Association, LungSask, and all nominating partners for this honor. I also want to thank Stop TB Canada, which I currently co-chair, for all their support and their faith in me. It never goes unnoticed. So thank you again for this recognition and for all your continued support. I really appreciate it.
We thank you for your lifetime dedicated to that advocacy. Our next recipient this evening is Dr. Brian Graham. Dr. Graham is a world-renowned researcher on pulmonary function studies, the outcomes of which help diagnosis of several lung diseases and in monitoring disease progression, and the effects of treatment and disease management. I would like to say congratulations to you, Dr. Graham, and I turn the floor to you if you would like to say a few brief remarks.
Thank you, Sarah. It'll be 49 years ago next month with my first contact with the Lung Association, and throughout my career, the Canadian Lung Association and the Lung Association of Saskatchewan really provided me with all the opportunities to accomplish anything that I was able to achieve throughout that. I'm really grateful for those opportunities and for the opportunity to work with so many of the other recipients that we have here tonight, And it is, as everyone says, truly humbling to even be considered as part of such an amazing group of people who've made such an amazing impact on lung health throughout Canada and the world. As so many people have said, anything I've done has been due to the support of so many team members. And it's been a real team effort to do this. And I can only accept an award like this on behalf of the many people that have aided me throughout my career. Thank you.
Thank you, Dr. Graham, and congratulations. Our final recipient from Saskatchewan is Mr. Trent Litzenberger. Mr. Litzenberger is a physiotherapist and certified respiratory educator who helped pioneer pulmonary rehabilitation in Saskatchewan. He has been a longtime dedicated staff member at LungSask and an educator and faculty member of ResTrek. Congratulations, Mr. Litzenberger, and I'll invite you for comment.
Sarah, thank you. Thank you, the CLA, and those that put forward this nomination for me. I'm going to say many of the same things that those before me have said, but it is incredibly humbling to be among the group of recipients being recognized today, many for their efforts in lung health, but this recognition is not mine alone to hold. My career in lung health would not have even been possible without the support of my family, who empowered me to pursue an education and a career that I was passionate about. And now my family, friends, and colleagues that continue to support me and challenge me to dream big in the world I work and continue to trust that what I do is having an impact to anybody living with lung disease and facing threats to their lung health. I'm going to take a note from Dr. Andrew Haleko from Manitoba. As a parent, I know what it's like to feel pride and achievement. I have many family members on this webinar this evening, and my mother, Myrna, is watching, and I just want to say, kid, did any of us see this happening? Sarah, it's incredibly humbling and hard to express just how grateful I am for this award. And I just want to say thank you.
Well, you're very welcome, and we thank you for your dedication. So that concludes our recipients from Saskatchewan, and we will now move further west to Alberta. Our first recipient out of Alberta is Ms. Diane Colton, a patient advocate and lung cancer survivor who speaks out about radon gas and lung cancer. She advocates at the federal level for improved lung cancer care and raises funds for lung cancer awareness. Ms. Colton, we thank you and congratulate you, and I invite you to say a few words.
Good evening and thank you. I am and will continue to be honored on receiving the King Charles III Coronation Medal. And thank you to the Canadian Lung Association for choosing me. Not something I would have ever had sought for myself. I am eternally grateful for receiving this award. I personally would not have chosen getting lung cancer, but lung cancer apparently chose me. So this has been a 15-year journey for me. 10 years of advocacy, and advocacy has been the best and the worst part of my life journey, and is something I will definitely continue to do. This medal is a reminder that I have so much more to do, and I've been privileged to work with the most amazing people. And again, we're all talking about collaborations, and I have been able to collaborate with so many people across the country. And everyone is gifted and everyone is important. So I'm never alone in the journey that I travel and in the work that I do. I do know that whenever I get frustrated now or get down, I just have to look at this medal and know that differences are being made. What I look forward to is the day that cancer of the lungs becomes an inconvenience rather than a death sentence. And the path for me is clear. So thank you.
Thank you, Ms. Colton. It's a real inspiration. Our next recipient is Dr. Richard Lee. Dr. Lee is recognized internationally for his work in improving asthma patient care. His research focuses on gaining a better understanding of the basic mechanisms underlying airway remodeling in asthma and the pharmacological treatment of airway inflammation. Congratulations, Dr. Lee. I'll pass to you for some remarks.
Thank you, Sarah. And first off, congratulations to the other 38 awardees this evening. It's a distinct honor to be in your company. As I've listened to the stories across the country, it strikes me that this award is being given for what I term as discretionary effort. It's what we do not necessarily for academic or financial gain, but it's what we do when no one's looking, and it's the right thing to do for our patients. It's the right thing to do for patient families.
It looks like we may have lost Dr. Lee. And Dr. Lee, we thank you very much and congratulate you for your hard work and the beginning of some beautiful remarks. If we can catch you on again, we will try to promote you back up. We will then move onward to Mr. David Osborne McDonald. Mr. McDonald is a volunteer who previously served as chair of the board of directors for the Canadian Lung Association, helping to broaden the association's mandate, including involvement in national anti-smoking campaigns. We are also pleased to have seen the legacy continue as Mr. McDonald's daughter, Margot, acts as our current vice chair of the CLA Board of Directors. Mr. McDonald, I will pass to you for some brief remarks.
Good evening, everyone, and thank you, Sarah, and your colleagues at the Canadian Lung Association. I'd also like to thank Nora Lacey and the members of the CLA board for their support of this King Charles III Medal Initiative. I am so deeply honored to receive this very prestigious award, and it is so gratifying to know that the Canadian Lung Association continues to be a vital and relevant advocate for the lung health of all Canadians. Thank you so much.
We thank you, Mr. McDonald, and congratulations once again. Our next recipient is Dr. George Smoltzer, who has improved the respiratory outcomes for the most premature infants by enhancing resuscitation techniques at birth, facilitating home oxygen monitoring, and reducing the incidence of bronchopulmonary dysplasia. I do not believe that Dr. Schmolzer is able to join this evening, but again, we congratulate him on this prestigious award. Our next recipient is Ms. Angeline Webb. Ms. Webb develops health policy and programming to reduce tobacco use and improve lung health. She prioritizes Indigenous leadership and perspectives to co-develop policies and programs that honor traditional practices. Congratulations, Ms. Webb, on this achievement, and I'll pass to you for remarks.
Thank you very much, Sarah. I would like to thank the Lung Association for my nomination, and I am truly humbled by and very much appreciate this honor. I have worked in commercial tobacco control for 20 years, and we have come a long way. And this is because of the wonderful and dedicated people and organizations that have committed so much time and energy to the prevention and reduction of commercial tobacco use. This work has truly made a difference in the lives and well-being of countless Canadians. I would like to say that any success that I have achieved is a result of the wonderful people and partners I work with. So thank you to Alberta Lung, LungSask, the Manitoba Lung Association, and the Canadian Lung Association. And please know, this medal is yours as much as it is mine. So thank you.
Thank you, Ms. Webb. So that concludes our recipients from Alberta. I do believe before we move on to British Columbia, I believe we had a technological challenge with Ms. Lynn McDonald earlier. Again, Ms. Lynn McDonald was serving as member of Parliament who created the Private Members Bill, who eventually became our Non-Smokers Health Act, again, the first legislation in the world that established smoke-free workspaces and public spaces. And I believe we have Ms. McDonald on the line again. Ms. McDonald, you may have to just accept as a panelist, and then we should be able to promote you. and allow you to say a few words.
Thank you very much. And I'm very grateful to the Canadian Lung Association for all the support it gave on my private member's bill, the Non-Smokers Health Act, 1988, a long time ago. It was an act to establish smoke-free work in public places and should have been brought in by a health minister, but no health minister would do it. And so it was organized differently with an enormous number of health groups and civil society groups who gave it support. It did pass, and in fact, it's gone around the world. New Zealand was very early to take it up, and it's had an impact. Smoking rates have gone down, as well as non-smokers or unwilling smokers in the workplace have had a better deal. So I would like also to mention Cynthia Callard and thank her for her excellent support as my assistant at the time. And Cynthia went on to work with Neil Collishaw in Physicians for a Smoke-Free Canada. So we're very pleased to see that smoking rates have gone down, but smoking remains the largest source of preventable mortality and disease in Canada and in the world. So there's more to do, and I look forward to the Canadian Lung Association in promoting the next reforms that are possible. Thank you.
Well, we thank you, Ms. McDonald, and our lungs thank you for those protective measures that you drove. Okay, so we will now finalize our journey west, and we appreciate everyone's patience as we make our way to British Columbia. Our first recipient there is Dr. Pat Camp. Dr. Camp has worked to make pulmonary rehabilitation and physical activity more available for those with lung disease. As a physical therapist, Dr. Camp works with rural and First Nations communities, co-designing services and making sure community voices are heard. Congratulations to you, Dr. Camp, and I pass to you for remarks.
Thanks very much, Sarah. And of course, I would like to start by thanking the Canadian Lung Association for this award, and also acknowledging, the staff and trainees and colleagues and mentors that I've had the privilege of working with, and my family, Dave, Holly, and Nathan, for their support. I've been working in this area for a while, but it was actually 10 years ago that a partnership began between myself at UBC and Dr. Travis Hollick at Carrier-Sekani Family Services, a First Nations healthcare organization in BC. And I just want to say that I'm so grateful to Carrier-Sekani Family Services and the First Nation communities that they support for deciding to make lung health a priority and for showing me how to do this work in a good way. So thank you very much again. Mosicho. Bye for now.
Thank you, and congratulations to you, Dr. Camp. Our next recipient of the award is Dr. Christopher Carlston. Dr. Carlston studies occupational and environmental exposures in respiratory disease, including longer-term changes caused by pollutants such as diesel exhaust. As a clinician, he works with lung health patients who have been exposed to occupational and environmental toxins. And unfortunately, Dr. Carlston had to step away, although he was part of the ceremony but could not stay. But he has sent along some remarks, and so I will read those now. Thank you to the CLA and all involved behind the scenes to unite us around these awards. I can honestly say I was surprised to learn of my award, and still now hearing the names of my colleagues, I am humbled to be in such inspiring company. Air pollution is the largest killer of any external risk factor worldwide, with approximately 9 million annual deaths. More than 95% of the world's inhabitants regularly breathe air of unacceptable quality by WHO standards. Motivated by this burden, and the belief that it's desirable to prevent disease rather than suffer and manage it, it has been an honor to work with a talented team for the last approximately 20 years. Our vision has always been to develop a program that focuses on and understanding the mechanisms of lung disease related to air pollution so that we can best inform those at most risk, provide evidence for guidelines that historically were perhaps logical but not deeply rooted in empirical data, and target preventative interventions that can reduce the impact of a nearly ubiquitous threat of compromised air quality. I suppose that this award is some sign that we have succeeded at least in part. I thank my family for the decades of enduring support, and in addition to my colleagues on this call, I want to thank the dozens of undergraduate and graduate students, study participants, and study team, volunteers, and staff. Above all, Miss Agnes Yun and Dr. Chris Ryder, the longest-standing members of the team, without which I would have most definitely been unable to have this success. Finally, I want to recognize my gratitude for the tremendous opportunity given to me to come from the United States and work in this amazing province of British Columbia and the country of Canada. This is something that I am especially grateful for now, in this time when we see leadership from our southern neighbor, an inexcusable and insulting stance, an attack on science, especially within environmental health science, which in the face of climate change and associated wildfires is more necessary than ever. I will forever be proud and grateful to Canada for being a role model for strong science in the context of social support network that emphasizes our common humanity. Thank you. This medal means a lot to me. So a thank you to Dr. Chris Carlston and a congratulations. Our final recipient of the evening is Dr. Stephen Lamb. Dr. Lamb has made significant advancements in lung cancer research during his career. He created the first lung cancer risk prediction model for people who never smoked, and is the co-inventor of the autofluorescent bronchoscopic system. Congratulations to you, Dr. Lamb, and we will pass to you for remarks.
Thank you, Sarah. I would like to thank the Canadian Lung Association for this award. It is truly a team effort by many colleagues across Canada and the thousands of patients who participated in our pilot studies to implement lung cancer screening that would change the outcome of patients with lung cancer by detecting and treating the lung cancer early. I would like to thank the contribution of the Terry Fox Research Institute and the Canadian Partnership Against Cancer, who supported our first pilot study involving 8 centers across Canada from coast to coast. I would also like to thank locally our BC Cancer Foundation and the Vancouver General Hospital Foundation, as well as the late Premier John Horgan for implementing the first in Canada province-wide lung cancer screening program. On a personal note, I would like to thank the Canadian Lung Association. I was one of the earlier recipient of the Canadian Lung Association Fellowship to advance my training in the field of lung cancer. Thank you very much.
A thank you to you, Dr. Lamb, and congratulations. And a congratulations to all of our recipients of this medal this evening. I have to say a huge thanks to our team who worked tirelessly to put this on. And I have to say a great deal of preparation goes into these types of events, but I have to say personally, though we were prepared, I was not prepared for the emotions of hearing the remarks and the responses by all of the medal recipients tonight. It truly is a reminder of the importance of why we all get up every morning and work in this field, and a reminder of the community and the importance of the community that we do that in. And so it's been a true honor for me to get to host these awards this evening. I just wanted to end with a final slide, just, again, reminding folks and a thank you for participating. It is, again, our 125th anniversary year. Hard to believe 125 years having an impact of lung health in Canada. We do encourage you to stay connected with us. We know we heard tonight none of us are strangers, but we encourage you to stay connected. Take a picture of yourself with your medal, share it on social media, and we would be happy to upload that to our website as well. We will be at the Canadian Respiratory Conference, and I hope to see many folks there. And of course, if you don't already, consider supporting CLA to ensure that we have another 125 years of wonderful work to do with one another. So a thank you to you all for your hard work. I hope you never quit. And it was our honor to be able to provide you with some recognition. Thank you and enjoy your evenings, everyone.